With the rules, calendar, operation of the House Committee, welcome. I want to thank our Sergeant at Arms, Mark Douglas, Warren Hawkins, Russell Salisbury, David Layton. Thank you for always being here and serving with us. Also, I want to thank our staff that's here with us as well, and for their quick turnaround times and everything that they do to make this committee run as smoothly as possible. We're going to get right to it. First, before the committee, we have Senate Bill 378. This is a PCS without objection. The PCS is before the committee. I have Representative Arp that will be presenting the bill. Representative Arp, you're recognized to present the bill.
There we go. Thanks, sir. Thanks. Thank you, Mr. Chairman, members of the committee. Senate Bill 368, the PCS, makes clear that public dollars will no longer flow to abortion providers like Planned Parenthood, ensuring our Medicaid program focuses instead on health care providers who offer comprehensive care for women without undermining the values of North Carolinians. It's very, very simple in the sense that there's three points to this. This aligns with the federal bill that was passed that requires North Carolina Medicaid program to remove Planned Parenthood as Medicaid providers, mandating termination of any ongoing Medicaid contracts with them. And this bill puts North Carolina in compliance with the One Big Beautiful Bill federal law. North Carolinians, taxpayers should never be forced to subsidize abortion organizations. The bill does three things: disenroll Planned Parenthood Federation of America and associated entities as Medicaid providers. It discontinues any Medicaid contracts with Planned Parenthood Federation of America and associated entities, and it engages other Medicaid providers to provide Medicaid services previously provided by the Planned Parenthood Federation of America and associated entity. I ask for your support.
Further discussion, debate. Representative Cunningham, you're recognized.
Thank you, Mr. Chair. I was looking for the PCS. Is the PCS online?
The PCS should be before the committee.
I don't see it online.
It's on the dashboard, Representative Cunningham, and then it's on the, should be emailed out. It's on the website.
Mr. Chair.
Any further discussion, debate? Representative
Motion if needed.
Hold your motion, Representative Torbett. Representative Quick, you're recognized.
Thank you, Mr. Chair. My personal opinions on abortion notwithstanding, the health care uses of Planned Parenthood for those who have or receive Medicaid gives me some pause on this bill. I don't know that I have a question. and I don't want to belabor the committee, but my real concern, and if you want to address it, you can, is that there may be some loss of health care. Not set aside abortion, but there may be some loss of health care services for women who receive Medicaid. And again, I don't know if there's a question there or if I'm just making a statement, but if you wanted to reply, I'm certain.
The proportion of what they provide relative to the other services, the testing and things like that, the transgender care is a small proportion of that, and we understand from our medical providers that there is adequate and ample and willing other organizations to fill that. And in fact, that's what this bill does, is encourage the department to go out and contract with others that are less divisive, less disalignment with North Carolinian values on abortion providers.
I do have a question.
Yes, sir, you're recognized.
Thank you, Mr. Chair. Then that does bring forth a question. My concern then would be a lag in time between this action and then finding other providers that will accept Medicaid or Medicare, particularly in rural areas and even in urban areas like Greensboro, where I live. Is there a mechanism that there's a timeline for finding these, or are we going to see a real lag in care?
Thank you for the question. This should be immediate. It's already federal law, and this brings us into alignment with federal law, so it's already the case in terms of the Medicaid. So we're complying with federal law.
Representative Cunningham, you recognize.
Thank you, Mr. Chair. I was thinking along the lines of the alignment after this goes into effect, because people do receive more services than just abortion services from that entity, and we want to certainly make sure as we transition that those individuals do not have a lag time. So Representative Art did answer the question I had about what they thought would happen with them moving to other primary care providers. So thank you, Mr. Chair.
Representative Ball, you recognize.
Thank you, Mr. Chair. Just a little bit of follow-up, Representative Art. You indicated that that was already in effect and that we are already looking for, and I assume already finding, providers to fill this need. Can you elaborate on that? And if you can't elaborate on it, can you tell me what's going to happen that we don't know about?
I'm not, of course, I'm with you on the legislative side in terms of setting the policy. Governor Stein is in charge of carrying out the law. That would be through DHHS and how they comply with federal law. So I hope that they're complying with federal law right now.
Just a quick follow-up, Mr. Chair.
Yes, ma'am.
Have we, those of us who have put this bill forward, made any attempt to assist in finding that care? Because to me, when we change the law, it behooves us to try to assist in its implementation in a way that does not hurt North Carolinians who really need those services.
Thank you, Representative Ball. No one wants to hurt North Carolinian citizens, especially in critical care like the Senate Bill 20 that we passed. Have already made a statement and provide additional funds to assist in women's health care, critical child care, early maternal care, and things of that nature. We've been, even since then, have been, as a policy, expanding these services there. What I would say is our medical providers, who are doctors and nurses and many in here, understanding the breadth of organization that provide these services. It's not that Planned Parenthood is the only organization that provides these types of things. And in fact, what we find is that Planned Parenthood almost, 80% of their places are in certain areas and so forth. So they don't provide comprehensive services in there. This is a way for us to comply with federal law. The effort is to, this mandates that DHS, in compliance with federal law, go outside and get other organizations to supply those testing needs.
Just a bit more, one more follow-up?
Go forward, it's early.
Okay. Yes, we're trying to align with federal law, and I understand that, but the women and others who will suffer from not being able to use Planned Parenthood services for things like birth control, cancer screening, and others, they are under Medicaid. This is to prevent anyone who's using Medicaid to pay for those services, correct?
This deals with Medicaid.
Medicaid only. So they're the people who can least afford finding another place to get those services. So I worry about them, and I think we all should. Thank you.
Representative Ball, what makes you think that they're the only ones providing those services? I mean, there are you agree that there are other providers out there, right? And that's what this taps into.
Well, I think I asked you to tell me who they are and what progress we've made in getting them aligned.
The family
Anyway,
alliances.
thank you.
Thank you.
Representative Jackson, you recognize.
Yes, we just want to comment on what this does. It redirects Medicaid funding to non-political community health centers, which provide true health care and continue our funding to pregnancy care centers. What I would also say, there's 4 other states that are already doing this: Mississippi, Missouri, Texas, and Arkansas. And as part of the 2012 budget, the North Carolina legislature passed legislation prohibiting state monies from going to Planned Parenthood. 2012. H.R. 1, as he mentioned, the big beautiful bill, prohibited federal Medicaid dollars from being provided to Planned Parenthood. What Senator Galey mentioned when she when the Senate passed this legislation, there's still $830,000 of grants that are available for Planned Parenthood to apply for, and this would freeze the $830,000 that they're not eligible to apply for.
Representative Longless, you're recognized.
I have no question now. Thank you.
Any further discussion or debate? Seeing none, Representative Torbett moves for a favorable report to the PCS to Senate Bill 378, unfavorable to the original bill. All in favor will say aye. All opposed say no. No. Opinion of the chair, the ayes have it. The ayes do have it. And Senate Bill 378 is passed to committee. Members, next we're going to have Senate Bill 405. Representative Lambeth, welcome to the Rules Committee again. Members, this is a PCS. Without objection, the PCS is before the committee. Representative Lambeth, you're recognized to present the bill.
Thank you, Mr. Chairman. Glad to be back. We continue to look for ways to solve this Medicaid rate dilemma. I think all of you know that I have been completely opposed to changing rates, and we've got to figure out how to fix this. I agree with every member of this chamber who says this is not tolerable. We've got to fix these rate changes. And this is another attempt to do that. This actually takes the Senate version that they sent us, that they crafted, and it takes out a couple items that had nothing to do with the Medicaid rates. One of those items being the Children's Hospital. So this is their bill. It deals with the rate changes, provides additional money to be able to fund Medicaid, and just adjust out things that did not relate in their bill to Medicaid. So again, this is trying to come up with as many solutions as we can that we hope one will stick and pass so that we can deal with this Medicaid issue that we're having to struggle with.
Any further discussion or debate? Seeing none, Representative Cotham moves for a favorable report to the PCS to Senate Bill 405, unfavorable to the original bill. All in favor will say aye. Any opposed say no. Opinion chair, the ayes have it. The ayes do have it. And Senate Bill 405 has passed the committee. Thank you, Representative Lambeth. Next, we're going to move to Senate Bill 599. This is a PCS without objection. The PCS is before the committee, and Representative Perret, you're recognized to present the bill from your seat.
Thank you, Mr. Chairman. Members, what's before you in this bill today is the House-passed salary plan for teacher pay, state employee pay, and it does include salary pay bonuses and increases for local law enforcement and our law enforcement. I think it takes what the Senate passed and then increases those amounts in almost every case when it comes to law enforcement. So as you will remember, the House-passed budget included remarkable and much-needed across-the-board raises for our teachers with an average of 6.4%. It put our beginning teacher pay to #1 in the Southeast, and the House-passed budget raised state employee pay 2.5%, which was actually better not only with than the Senate, but also what our governor put in his budget. So this received a lot of bipartisan support, as you remember, and what we're doing here is we are once again solidifying our support for this salary package. And in this bill, these salary increases that are contained here would be contingent upon the General Assembly passing a current Operations Appropriation Act for 25-26, which of course the House has been willing to do in a comprehensive fashion since late last spring. Unfortunately, we have not been able to have a willing Senate to come in a comprehensive way with the House to negotiate that out. So this is what this does, and I hope that you will support it. Thank you.
Any further discussion or debate? Seeing none, Representative Cotham moves for a favorable report to the PCS to Senate Bill 599, unfavorable to the original bill, with leave that staff make technical changes as needed. All in favor will say aye. All opposed say no. Opinion chair, the ayes have it. Ayes do have it, and the Senate bill has passed the committee. Is there anything else that needs to come before the committee? Seeing none, we're adjourned.